Frank thought Medicare finally solved his prescription problem. Then, his retirement started leaking money from every direction, quietly, slowly, relentlessly. At first, he blamed inflation, then groceries, then gas prices. But the real problem was hiding inside his Medicare plan, and it took Frank nearly 2 years to understand it. Frank Donovan is 72. He lives outside Pittsburgh, Pennsylvania, former steel plant maintenance supervisor, worked 40 years without stopping, never missed shifts, never lived extravagantly. Frank retired in 2021 with $620,000 in retirement savings, a modest pension, and Social Security. He believed retirement would finally feel stable, predictable, simple. Instead, healthcare became its own full-time job, especially after Medicare's new $2,000 drug cap arrived, because what sounded like protection created entirely new confusion. In late 2025, Frank received his annual Medicare renewal packet. It looked exhausting, hundreds of pages, tiny print, confusing comparisons, different plans everywhere, different numbers everywhere. Frank stared at the paperwork for 20 minutes, then gave up. He renewed the same plan automatically. Just one click. That decision slowly changed his retirement, because Medicare plans quietly evolve every single year. Different formularies, different deductibles, different co-pays, different pharmacy agreements, different coverage rules. Frank didn't notice any of it. Most retirees don't, because the changes rarely arrive dramatically. They arrive slowly, one adjustment at a time. At first, the changes looked harmless. His monthly premium rose slightly. Then one medication changed pricing tiers. Then another medication required prior authorization. Then his inhaler stopped qualifying for preferred pricing. Frank thought, fine, I'll adjust. But retirement adjustments accumulate fast. Suddenly, $19 higher here, $42 higher there, $87 unexpected pharmacy charge, $114 specialist copay. None of these numbers felt catastrophic alone. Together, they slowly changed Frank's lifestyle. He started checking prices before buying groceries, stopped ordering coffee outside, drove farther for cheaper pharmacies, began delaying small purchases constantly. Retirement started feeling tighter every month. Not disastrous, just narrower and narrower and narrower. This is how retirement stress really works, not through one giant collapse, through hundreds of tiny pressures, tiny decisions, tiny fears, until your peaceful retirement slowly disappears. Then the phone calls started, hours waiting on hold, transferred between departments repeatedly, different answers from different representatives. Frank felt completely lost. One insurance employee told him his medication was covered. Another claimed it was not. One pharmacy quoted $63. Another quoted $141. Same medication, same insurance, same week. Nothing made sense anymore. Frank began carrying folders everywhere, writing notes constantly, tracking reference numbers, tracking billing mistakes, tracking pharmacy receipts. Healthcare became administrative warfare, and Frank was exhausted. Then, something changed emotionally. Frank stopped opening healthcare letters immediately. Every envelope felt threatening. Every January felt dangerous. He stopped sleeping well, stopped seeing friends regularly, canceled fishing trips twice, avoided traveling completely. Because uncertainty changes behavior, especially after 70. Healthcare inflation kept rising. Insurance costs kept moving. Meanwhile, Frank's retirement income barely changed. Social Security increased slightly, but not enough, not even close. Frank no longer felt retired. He felt financially hunted. This is the fear many retirees never admit publicly. They are not terrified of death. They are terrified of becoming financially fragile before death arrives. Then came the breaking point. One winter morning, Frank arrived at the pharmacy for insulin. The price had changed again, this time dramatically. Frank simply stood there silently, confused, embarrassed, exhausted. The pharmacist noticed immediately. She asked one simple question. "When was the last time you reviewed your Medicare plan?" Frank couldn't remember. That moment shook him deeply, because suddenly he realized the system had changed repeatedly, but he never adapted with it. A week later, Frank attended a Medicare counseling workshop at his local library. Honestly, he almost skipped it, but inside that room, everything finally became clear. A counselor explained how plans evolve yearly, how pharmacies negotiate prices differently, how formularies quietly change, how retirees accidentally overpay for years. Frank learned he had been using one of the least efficient plans available locally, not intentionally, just automatically. During the next enrollment season, Frank rebuilt everything carefully. New pharmacy network, better drug tiers, lower exposure limits, simpler payment structure, and more predictable monthly costs. That process saved him nearly $4,100 the following year. But the biggest change wasn't financial. It was emotional. Frank finally relaxed again. He started fishing again, traveling short distances again, sleeping peacefully again. Retirement finally felt like retirement. Here's the lesson Frank learned too late. Retirement problems rarely destroy people overnight. They wear people down slowly, through confusion, through complexity, through small financial leaks repeated for years. The retirees who survive financially are not always richer. They simply stay engaged longer. They review plans yearly, ask uncomfortable questions, adapt early, and refuse to ignore small problems. Because in retirement, ignoring the system can become incredibly expensive. And maybe the biggest healthcare danger in retirement isn't illness itself. Maybe it's exhaustion from navigating the system around it. Subscribe for more real retirement insights.